You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
Anneliese Dressel of the Health Hub Times Square in Ballincollig joining me this afternoon. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome. Lots of questions in. Let's see, can we do our best to get through as many of them as we can? Now, I'm going to put two in together because they're both to do with children and children after COVID. First question, my daughter's 12, had COVID early in January, very bad cough and an ear infection with the COVID. The ear infection got so bad she needed to have an antibiotic at the time. Now she has a very bad strep throat infection as we start into February, very high temperature. She's been on antibiotics for the last 10 days, into day 5 of the antibiotics. And to be honest, the throat is still quite sore. She's very tired, but thankfully her temperature is back to normal. What would Anneliese suggest in order to speed up her recovery and to try to boost her immune system going forward? And then there was another listener question for Anneliese. Could you recommend something to build up my 4-year-old's immune system? She's had COVID 3 times since last September and also had the flu. She's worn out and extremely pale. Also, if you could recommend something for me, I've, like the child, has had COVID 3 times and the tiredness is unreal. That's from Paula. So I suppose deal with the children first.
Yeah, so I think what they definitely probably both need a tonic at the moment just to pick them up. So I would do a good kids multi. The Source of Life Gold is what I always recommend for adults and what I'd recommend for this mum as well. But they do a kids one, which is the Animal Parade Gold for children, and it's a fantastic tonic. It gives them all their vitamins and minerals, and I'd give them at least a month of that each just to build them back up, because when they're sick, their appetite wouldn't have been good, so they're definitely probably depleted nutritionally. In terms of immune system, there is a fantastic kids product which is a mushroom extract. Now, medicinal mushrooms have been used in Chinese medicine for over 2,000 years, and we're only starting to kind of get to grips with them in the West here, but they are amazing, especially for immune system function. And this is by a company called HIFAS, H-I-F-A-S, and it is it's called Dr. Immune 5, and it's a really tasty, palatable drink with mushroom extract in there for kids, and there's nothing quite like it for an immune boost. So for the two littlies, I would definitely recommend that. And then just in the long term going forward, Patricia, we sell buckets of the BioNutri Elderberry Complex, and that's got a combination of immune boosting nutrients in it, and parents put their kids on it at the beginning of September, and they swear that it keeps the coughs and colds and the nasties away, or at least they don't get them as severely. So prevention is always key with natural medicine. So adults could take that as well for their immune system, this BioNutri, and they do an adult and junior blend. So I would recommend that in the long term. But for the short term for the kids, the Animal Parade Gold Tonic, and then the HIFAS Dr. Immune 5 for the immune boost. And then for the mum, I'd recommend the Source of Life Gold. It's fantastic.
It's brilliant. It's brilliant.
Yeah.
I took it every time I've had COVID. I've taken it after COVID because it's that tiredness. It's so hard to explain to anyone. It's just, you can sleep, have a really good night's sleep, and you just still wake up exhausted. It's a horrible feeling.
It is, and then if you feel okay and you go out and you do a walk or something, you're absolutely right.
Yeah.
It's horrible, yeah.
Yeah. Okay, hi, question for Anneliese, please. One of those embarrassing ones. I'm suffering from very bad flatulence of late. It's very embarrassing. What could you advise? There's been absolutely no change in my diet. I've also had about 4 kidney infections in the past year. I'm in my mid-50s and I'm wondering, could those kidney infections be related to changes around menopause? So I suppose start with the flatulence one first.
Well, actually, I might start with the menopause one, because, yes, it is definitely. When you become menopausal with the drop in estrogen, your tissues can dry up and they're a lot more prone to damage and infection, and a lot of women would get an increase in kidney infections. So for this particular lady, I'd say she's been taking a lot of antibiotics, and the antibiotics have affected the bacteria in her gut, and that's probably why she's got flatulence. So in her case, for the short term, for the flatulence, what I would recommend is taking a digestive enzyme every time that you eat. That'll just help your own body's ability to break down food, so there's less of it available for bacteria to kind of ferment. And I would also take a very good quality probiotic. So we love there is the Nature's Plus have come out with a range of probiotics actually, and we're getting great feedback on them. So there's the Immune Microbiome is the Nature's Plus one, and there's over 18 different strains of probiotic in there, and it is really, really good. If you can't get your hands on that, the Udo's 8 is another very good one, and they do an adult blend as well. So definitely take a probiotic and a digestive enzyme for the short term. If you do suffer from flatulence and you have to go out, the best thing is the activated charcoal. So you take it before you eat, and then you take it again after you eat. And the charcoal actually soaks up the gas. So it means that if you do need to go to an event, that you can be confident that you can go out and you're not going to be worried about being an embarrassment to yourself. So the activated charcoal is not going to fix any problem, but it certainly is a good one. And then in terms of the kidney infections, so what I would recommend for women in menopause is if they find that they have dryness of tissue, I always recommend the sea buckthorn oil. It's omega-7. And it's fantastic for dry eye, dry mouth, vaginal dryness, kidneys, but it does take a little bit of time to kind of build up in the tissues. So I would certainly recommend that. Possibly consider HRT, and if not HRT, natural HRT. So we get great feedback on the Revive Menoactive is a very good product. I've tried it myself and I think it's great. And the Nutri Advanced is another one. They do a menopause support one, which is fantastic as well. So come at it from the sort of support the hormone as opposed to the kidney infection side.
Okay, actually just stay on HRT. Somebody says that they're taking estrogen supplements and is worried, is it harmful for breast cancer?
Well, I think what they do, they recommend that people who have a family history of breast and cervical cancer, that they're not suitable. So if you have a family history of it, you will not be a suitable candidate for HRT. But if you don't have a family history of it, no, it will not increase your risk of breast cancer significantly more than anything else would.
Okay, hi Anneliese. I'm suffering with a terrible burning in my stomach. Every test from the doctor has come back clear, so the doctor is putting it down to anxiety that's causing the burning. Now I am on antidepressants. I have been for over 7 months, and I'm finding the antidepressants are really working and are really good. But the burn is back in my stomach again for no reason. What would you suggest?
Well, I think that it probably is actually burning in the stomach, and sometimes what the doctors will do is they take a look down, and if they don't see anything, they say there's nothing wrong. But actually, if your stomach lining is exposed at any level and you're releasing acid when you eat, you can get a burning feeling. Certain foods disagree with some people and give them a burning feeling. So I think that's probably the most sensible, starting point to try and see is that it is actually burning in the stomach. So for that, I would recommend taking slippery elm before every single meal. The best one, I think, is the BioCare Slippery Elm Complex. And you take a capsule about 5 or 10 minutes before you eat, and it helps to line the stomach and prevent, the acid from irritating stomach lining. There's also a product called GI Wellness by Nature's Plus, and it's a complete and comprehensive gut kind of healing product. You can get it in capsules or you can get it in powder. The powder's better. And that will help. If there is any exposed stomach lining in the stomach, it will help to heal that. So you could try that. And then there's another product I always recommend for people for burning, and I take it myself and it works brilliantly, and it's called Zinc Carnosine, Carnozin. And that helps tighten up that little esophageal muscle at the top so you're not getting any kind of reflux feeling. So I would just do a course of that for 1 or 2 months, and hopefully that will take care of the problem. And if it comes back, just repeat it again. And
well done for going to the doctor and highlighting that you needed help with the antidepressants, because people can find that very difficult to make that call and go into the doctor and talk about the fact that you're feeling down.
Sorry, excuse me, Patricia. Absolutely. Always the first port of call, because you know what, doctors will do blood tests and they'll rule out anything physiological. Yeah. So that's really important. And, for a lot of people, they get a very good short-term benefit from antidepressants. So I think anything that helps, take it. Yeah, absolutely. And now, any natural remedies, please, for hemorrhoids, better known as piles, thanking you. And by God, they can be painful. Absolutely. And, I suppose what happens with hemorrhoids is that there is generally a blood vessel that has blown out. It is often as a result of diverticulitis, constipation. They're all kind of involved in it. And they can become very, very swollen, painful and itchy. So a sign that you have them might be a bit of itching in the back, or pain, or sometimes you might see blood on the toilet paper, and that could be a sign that one of them is just slightly damaged and bleeding. So The best thing to do is try and prevent them in the first place. So if you are a person that suffers from constipation, and in my book, Patricia, constipation is if you don't have a bowel movement every day, and if there's any type of straining at all, or if the stool is pebbly, any of those three would classify in my book you as being constipated. So you can take natural fibres like psyllium husk is really good. Put a spoon of it on top of your breakfast cereal. It's a great stool softener. And then there's a lovely aloe complex, which is a natural laxative that you can take with some aloe vera in there and magnesium and rhubarb extract. And that's a very gentle and safe laxative. You take it before you go to bed. You don't need to worry that you're going to be caught short with it. And then in terms of the piles themselves, Dr. Dealish Clare does a great witch hazel cream, and we do sell buckets of it, especially to pregnant women. It's very, very effective, and it works fairly quickly as well. So that's the Dr. Clare witch hazel cream.
Yeah, it was following the birth of my son. I got piles, and in all my life, I will never forget the pain of it. Never had it since, and thankfully I never will again. Okay, question. I'm a woman in my 70s. What would Anneliese recommend? What dose of vitamin D should I be taking? Thanking you.
Very difficult to know because there's various different factors in terms of your genetic makeup and your ability to make vitamin D from the sun or absorb it from food, the amount of time you spend outdoors. So the best thing to do is actually get tested. Now, your doctor can test your vitamin D levels for you. They tend to be a bit reluctant because it's pricey. But we do have tests in the shop here. We have a very basic, cheap and cheerful test, which I think is about €13. That tells you whether you have enough or whether you're deficient. And then we have a very good quality test for €75 that will tell you exactly how much vitamin D you have and exactly how much you need. So I would definitely recommend getting a test done. And other than that, don't take a high dose of vitamin D. 1,000 IU is more than enough for everybody unless you know you need more. Because vitamin D will increase your risk of increase your calcium absorption, and high levels of calcium in the blood will increase your risk of plaque formation. It can harden the cholesterol in your arteries. So it can help. It can increase risk of heart disease. So don't
be
take
careful.
too much vitamin D.
Okay, we'll leave it there. Anneliese, thank you for that. And as always, thanks for joining us.
Thanks.
We'll chat next Monday. That's Anneliese Dressel, the Health Hub, Times Square in Ballincollig. All of the information will go up on Anneliese's website this afternoon, which is healthhubstore.com. And then John Paul will put it up as a separate podcast, wherever you get your podcast from.